So, hello students, very good morning to everyone. And today we are going to start a new chapter, that is anti-Parkinsonism drugs, anti-Parkinson drugs, or it is also called as anti-Parkinsonism drugs. So, before starting that, we'll revise what we had learned in the last lecture. So, in the last lecture, we had learned the oral hypoglycemic agents. So, the types of oral hypoglycemic agents are: first one is sulfonylureas, then metformin, then your pyranos, then your thiazolidine dione derivative. So the example of sulfonylureas is glibenclamide, and the example of bicarbonate is metformin. Example of pyranos is dopagliflozin, and the example of thiazolidine dione is pioglitazone. Then again in the last lecture, we had learned the synthesis of pioglitazone. So the synthesis of pioglitazone start with 2 in bracket 5 ethyl pyridinyl 2 ethanol, and it is condensed with 4-fluorobenzene 4-fluorobenzonitrile in presence of sodium nitrite to give 4 in bracket 2,5 ethyl 2 pyridine ethoxybenzonitrile, which on reduction yield the compound, then that having C double bond OH group, then that aldehyde on reaction with thiazolidine 2,4-diene in basic medium yield product that is on hydrogenation yield your pioglitazone. This is all about that what we had learned in the last lecture. So now today we are going to uh, learn the new chapter, that is 2.6 anti-Parkinsonism drug. So I will start with this Parkinsonism drug. So so before that, we'll understand what is Parkinson. So the Parkinson, it is a disease named after Dr. James Parkinson. So it is the Parkinson, it is the name of scientist who. So it is a disease named after the drug, that is after after the name of Dr. James Parkinson, who first described the disease condition called as shaking palsy. So this is the scientist Dr. James Parkinson, who first described the disease condition called as shaking palsy. And the Parkinson disease is due to abnormalities in CNS system. So this Parkinson disease is due to abnormalities in central nervous system and malfunctioning of the lower part of the brain. And there is a malfunctioning of lower part of the brain. So these are the two reasons. So the Parkinson disease is due to abnormalities of central nervous system and malfunctioning of lower part of the brain, and it mainly causes rigidity in the body. It mainly causes rigidity in the body. So it mainly causes the rigidity in the body. So these are the typical appearance of Parkinson disease. It mainly causes rigidity in the body. Then it affects the posture. It affects the posture. So it affects the posture. Then it affects the posture, movement, and speech. So it is mainly causes the rigidity in the body, and it affects the posture, then movement and speech. So the typical appearance of Parkinson disease is it has a mask-like facial expression, stop posture, forward tilt of trunk, reduced arm, swinging, then rigidity, fixed elbow and wrist, slightly flexed hips and knees, then shuffling short step gait, step gait, and then trembling of extremities. So again, these are the typical appearance of Parkinson: tremors, facial mask-like facial expression, back rigidity, tremors in your hands, limbs, tremors in your uh, head. So these are the symptoms of your typical appearance of Parkinson disease. So the person who is having Parkinson, these are the typical appearance of uh, that person. So there are three types of Parkinson disease. That is, first one is idiopathic paralysis agitans, then post-symptomatic Parkinson, and atherosclerotic Parkinsonism. So now we'll see what is anti-Parkinson drug, or it is also called as anti-Parkinsonism drug. So the drug which is used in the treatment of Parkinsonism disease and elevate the symptom are called as anti-Parkinsonism drug. So the drug which is used in the treatment of Parkinson disease and elevate the symptoms are called as anti-Parkinson drugs. So the drug which elevate these symptoms, tremors, or then worst is stop gesture, tremors in your face, limbs, and legs. So that drug is called as anti-Parkinsonism drug. So the drug which is used in the treatment of Parkinson disease and elevate the symptoms of Parkinson. It is called as elevate the symptoms are called as anti-Parkinsonism drug. And then next slide, you see the symptoms of Parkinson. So the first symptoms is tremor is the most visible symptoms of this disease. So tremors in your head, limbs, and legs. It is the most visible symptoms of this disease, and it occurs at a rest, and it is most common in hands and arms. It is most common in hand and arms, and as the disease progresses, the tremors may affect more of the body, and or it become more pronounced. So as the disease progresses, the tremors may affect more of the body and it become more pronounced. So the first symptoms is tremors is the most visible symptoms of this disease. It occurs at a rest, and it is most common in hands and arms. As the disease progresses, the tremors may affect more of the body and or become pronounced, or it become more pronounced. So this is the first symptom. Then the second one is rigidity or muscle stiffness result from shortening of the muscle. So rigidity or muscle stiffness. So rigidity and muscle stiffness result from shortening of muscle. This rigidity causes unstable posture and awkward gait. So this rigidity in muscle and shortening of muscle, it causes the unstable posture and awkward gait. This result in movement of limbs. So this result in movement of this limbs. And the next symptoms is slow down slow movement or bradykinesia. Slow movement or bradykinesia. So this slow movement, the term is called as bradykinesia. The slowdown of the movement associated with the inability to start the movement, that is freezing slow movement. It also causes shuffling wall. So the slowing down of movement, it is called as bradykinesia. The slowdown of the movement associated with inability to start the movement, freezing slow movement. It also causes shuffling wall. So this is the third symptoms. Then the next symptoms is due to stiffening of muscle, there will be difficulty in eating and swallowing as well as slurred speech. It may also affect bowel and bladder movement control. So due to stiffening of muscle, there will be difficulty in eating, swallowing as well as slurred speech. So there is a problem while eating, while swallowing the food, while swallowing while drinking, or while eating, or while speaking. So there is a problem to that person due to stiffening of this muscle, and it may also affect the bowel and bladder movement control. It also affects the bowel and bladder movement control. And in acute condition, the facial muscle freezes, resulting into mask like a facial expression. So in acute condition, the facial muscle freezes, resulting in a mask like facial expression. So mask like a facial expression. So these are the symptoms of this Parkinson. So the first symptoms is tremor is the most visible symptoms of this disease, and it occurs at a rest most, and it is most common in hands and arms. As the disease progresses, the tremors may affect more of the body and or become more pronounced. Then the second one is rigidity of muscle stiffness resulting from shortening of the muscle. This rigidity causes unstable posture and acquired gait. Then this result in the movement of limbs. Then the slowdown movement, that is called as bradykinesia. So slowdown of the movement associated with the inability to start the movement. Freezing slow movement, it also causes the shuffling walk. Then due to stiffening of muscle, there will be difficulty in eating and swallowing as well as and slurred speech. It may also affect the bowel and bladder movement control. And in acute condition, the facial muscle freezes, resulting in a mask like facial expression. So these are the symptoms of Parkinson. So if the person having the symptoms, it means that that person is having this Parkinson disease. So this Parkinson, it is a this disease is due to abnormality in central nervous system and malfunctioning of the lower part of the brain, and it mainly causes rigidity in the body and affect posture, movement, and speech. So these are the symptoms of your Parkinson. Then in the next slide, here in this slide, we'll see the chemotherapy. So, in chemotherapy, the drug used for the treatment of Parkinson, disease and elevate the symptoms are called as anti-Parkinsonism drugs. The drugs used for the treatment of Parkinson disease and elevate the symptoms of Parkinson, that is called as anti-Parkinsonism drugs. So the changes takes place in the body due to disease. Due to the disease cannot be usually reversed. So the whatever the changes taking place in your body due to that Parkinson disease, that cannot be usually reversed. Therefore, the drugs used for the treatment can only alleviate the symptoms. It can only alleviate the symptoms and allow the patient live with lesser difficulties. So whatever the changes taking place in the body due to this disease cannot be reversed. Therefore, the drug used for the treatment can only alleviate the symptoms and allow the patient to live with the lesser difficulties. However, the disease can be completely cured. Apart from the chemotherapy, the treatment should include physiotherapy. So, for complete treatment or for the complete cure of the disease, apart from this chemotherapy, apart from the taking the drug, the treatment should include physiotherapy activities and physiological support. So that person will also need the physiological support, physiotherapy and activities. A prolonged treatment with less toxic drug is needed. So a prolonged treatment with less toxic drug is needed. A change of drug and the dosage is needed from time to time. So the changes of the drug and the dosage is needed from the time to time. So the impulses are transmitted at the nerve end. By means of chemical neurotransmitters. Anti-Parkinson drugs function as a antagonizing this chemical transmitter, and thus it blocks the origin of the tremor. So the impulses are generated. So the role of this anti-Parkinson drug is that the Parkinson drug function by antagonizing this chemical transmitter and thus blocks the origin of the tremors. So the impulses are transmitted at the nerve end by means of chemical neurotransmitter. The anti-Parkinsonism drugs function by antagonizing this chemical transmitter and thus it blocks the tremors. So chemotherapy, the drug used for the treatment of Parkinson disease and elevate the symptoms are called as anti-Parkinson drug, and whatever the changes taking place in the body is due to disease cannot be reversed usually. Therefore, the drug used for the treatment can only alleviate the symptoms and allow the patient with lesser difficulty. However, the disease can be completely cured if, apart from the chemotherapy, the treatment should include physiotherapy, activities, and the physiological support. After prolonged treatment with less toxic drugs is needed, a change of drug and the dosage is needed from time to time. So here in Parkinson disease, the impulses are transmitted at the nerve end by means of chemical neurotransmitter. So the anti-Parkinsonism drugs function by antagonizing this chemical transmitter and thus blocks the origin of tremors. So the role of this anti-Parkinson drug is that it blocks the origin of tremors. So it reduces the tremor. Then this the type of anti-Parkinson drugs. So there are two groups of anti-Parkinson drugs are there. That is uh, this anticholinergic agent and dopaminergic agent. So we'll see that what is anticholinergic agent. So they so this they antagonizes the cholinergic agent which stimulate the parasympathetic nerve system. Example, belladonna alkaloid were the first compound used for symptomatic treatment of this disease. For example, atropine and hyoscine. 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 These are the two examples of this alkaloid. Belladonna alkaloid were the first compounds used in the symptomatic treatment of disease. For example, atropine and hyoscine. So this anticholinergic agent, they antagonize the cholinergic agent. So the role of this anticholinergic agent is they antagonize the cholinergic agent which stimulate the parasympathetic nerve system. And the example of these anticholinergic agents are belladonna alkaloid were the first compounds used in the symptomatic treatment of the disease, atropine and hyoscine. And again they are classified into two types. Again it's classified into two types, so we'll see in the next slide. Then the next one is dopaminergic agent. So dopaminergic agent. So dopamine is the important neurotransmitter in the central nervous system. So dopaminergic agent. So dopamine is the important neurotransmitter in the central nervous system, and its depletion is associated with the clinical condition of Parkinson disease. The compound which able to replenish dopamine in CNS or themselves act as an anti-Parkinsonism drug, that is called as dopaminergic agent. So dopamine is the important neurotransmitter in the central nervous system, and its depletion is associated with the clinical condition of Parkinson disease. The compounds which are able to replenish dopamine in the CNS. The compound which is able to replenish dopamine in the CNS or themselves act as the anti-Parkinsonism drug are called as dopaminergic agents. So this is about chemotherapy, anti-Parkinson drugs. So there are two types, that is anticholinergic agent and dopaminergic agent. So we'll see one by one. So first one is anticholinergic agent. So the under this anticholinergic agent, the first it classified into two types. First one is pyrrolidine derivative, pyrrolidine derivative. So this is the example of that pyrrolidine derivative, and the example is procyclidine hydrochloride. It is its brand name is Chemadrin. Procyc- Procyclidine hydrochloride. So this is the structure of procyclidine hydrochloride. It is available in the salt form, hydrochloride salt. So this is the box of top tablet procyclidine 5 mg tablet. Is also what is Prodrine. So you see this procyclidine hydrochloride, which is a uh, so it belongs to class of pyridine derivative. So this procyclidine hydrochloride, it belongs to the class of pyridine derivative, and the drug is used for symptomatic treatment of post encephalitic Parkisonism. The use of this drug is it is used for the symptomatic treatment of post encephalitic Parkinsonism. And benzhexol is another example in which the pyridine ring is replaced by piperidine. So this this benzhexol is another example of pyridine in which this piperidine ring is replaced. This pyridine ring is replaced by piperidine. So this is the structure of that, and the use is it is used for the symptomatic treatment of encephalitic Parkinsonism, and the side effect is it causes drowsiness, dizziness, causes constipation, flushing, then causes nausea, nervousness, and blurred vision, and dryness of mouth occur. So these are the side effect of this proclidine hydrochloride. So this is the structure of proclidine hydrochloride, and it comes under the class pyrrolidine derivative. It's a derivative of pyrrolidine. It having this benzene ring OH and this pyrrolidine ring. So, so the uses of this proclidine is this drug is used for symptomatic treatment for post encephalitic Parkinsonism, and the side effects are it causes drowsiness, it causes dizziness, causes constipation, nausea, vomiting, and blurred vision, and dryness of mouth may occur. It having this pyrrolidine ring, that's why it's called as pyrrolidine derivative, having this pyrrolidine moiety. So this is the use, and this is the side effect of this proclidine hydrochloride. Then the next class is under the cholinergic agent is anticholinergic agent is phenothiazine derivative. So it having this phenothiazine moiety, and the name of this compound is ethanopropazine. The example is ethanopropazine hydrochloride. They are present in its salt form, and its brand name is paracetamol. This is the it is a methaphromazine. So it is a derivative of this CH replaced by methane. Then it is methaproprazine. So this is the structure of ethanopropazine hydrochloride, and it's a derivative of this phenothiazine derivative. It's a phenothiazine derivative, and this ring, two benzene ring joined together by nitrogen sulfur heteroatom, that is called as phenothiazine. So this is the basic skeleton of phenothiazine, and the example is ethanopropazine, ethanopropazine. So this ethanopropazine, it belongs to phenothiazine class of compounds. So it belongs to phenothiazine class of compounds, and the use of this drug is it is used in the management of Parkinson. It controls rigidity, and reducing spasm. So the use of this phenothiazine derivatives. This drug is used for the management of Parkinson disease. It is used for the management of Parkinson disease, particularly for the control of rigidity. It controls the rigidity, and it also used for reducing spasm, tremors, and occluration, and it has a mild local anesthetic action. It has mild local anesthetic action. So the side effects are the use is the drug is used for the management of Parkinsonism or Parkinson disease, particularly for the control of rigidity. It also used for the treatment of spasm, tremors, and occlusion, and it has a mild anesthetic effect, or it has a mild anesthetic action. The side effects are this causes uncontrollable movement of agitation. It causes uncontrollable movement of agitation, seizures, then severe dizziness, fainting, sometimes coma, very deep sleep, irregular heartbeats, and high or low body temperature. The side effects is high and or low body temperature. So this is about second class of cholinergic agent, anticholinergic agent, that is phenothiazine derivative. An example is ethanopropazine. This is the structure of that ethanopropazine, and this is the box of that ethanopropazine tablet. And the use of these drugs belong to the class of phenothiazine class of compound, and this drug is used for the management of Parkinson disease, particularly for control of rigidity. It also used for reducing spasm, tremors, and occlusion. It has a mild anesthetic effects, and this can cause uncontrollable movement, agitation, seizures, severe dizziness, fainting, coma, and very deep sleep, and irregular heartbeat, and high or low body temperature. So these are the side effect of this ethano ethopropazine is ethopropazine hydrochloride. It present in its hydrochloride salt form. Then the next class of anti-Parkinsonism drug is dopaminergic agent. Dopaminergic agent. So the under this dopaminergic agent class is alpha amino acid, and the example is dopamine. So dopamine is it is a it belongs to this alpha amino acid class of compounds. So this will see what is dopaminergic agent. So dopamine is the most important neurotransmitter in the central nervous system. Dopamine is the most important neurotransmitter in the central nervous system, and its depletion is associated with the clinical condition of Parkinson disease. So dopamine is the most important neurotransmitter. So it is one of the neurotransmitter in the central nervous system, and its depletion is associated with the clinical condition of Parkinson. So depletion in the dopamine is related with the condition of Parkinson disease. So thus the compound which able to replenish, so the compound which increases the dopamine transmitter, dopamine neurotransmitter in the central nervous system, or themselves act as the anti-Parkinsonism drug, are called as dopaminergic agent. That drug is called as dopaminergic agent. So thus the compound which able to replenish dopamine in CNS, or themselves act as the anti-Parkinsonism drug, that is called as dopaminergic agent. So, this is the levodopa. It's the alpha amino acid, and it is dopamine is obtained by the decarboxylation of this levodopa. So after decarboxylation, the loss of CO2, and you will get this dopamine. So when levodopa is administered and it can penetrate, so when this levodopa is administered, it can penetrate the blood-brain barrier. It can the very important role of this levodopa is it can be administered. So when the levodopa is administered, it can penetrate the blood-brain barrier, that is BBB, triple B, and get decarboxylated to give dopamine. So in brain, it decarboxylated to give dopamine, and thus it replaces dopamine in the brain. So thus it replaces the dopamine in a brain because the decarboxylation reaction taking place in your brain. So when this dopamine is administered, it can penetrate the blood-brain barrier BBB and get decarboxylated to give dopamine. It get decarboxylated to give dopamine. Thus it can replace the dopamine thus it can replace the dopamine in the brain which depleted in the patient having Parkinson disease. So thus it can replace the dopamine in a brain which is depleted in the patient which having Parkinson disease. So it also used to control similar neurological symptoms caused by manganese poisoning. So it is also used to control similar neurological symptoms caused by manganese poisoning. So due to manganese poisoning, the similar neurological symptoms caused. So it can also control that the poisoning of the similar neurological symptoms which is caused due to manganese poisoning which is caused due to manganese poisoning. So this levodopa belongs to the amino acid class of compounds. So this levodopa comes to amino acid class of compound because it having this NH2 and COH. It's a alpha amino acid. Both this NH2 and COH present on this alpha carbon. That's what is called as alpha amino acid. So this carbonyl group is this alpha to this carbon, NH2 is alpha to this, so that's what is called as alpha amino acid. So this levodopa belongs to amino acid class of compounds, and uses of this dopamine is commonly used as an anti-Parkinson drug. It is commonly used as an anti-Parkinson drug, and it helps to reduce rigidity and tremors and increase the alertness of patient. It increases the alertness of patient. So it is commonly used as an anti-Parkinson drug. So it is commonly used as an anti-Parkinson drug, and it helps to reduce the rigidity and tremors. It helps to reduce rigidity and tremors. So the rigidity and tremors, these are the most these are the symptoms of Parkinson. So the role of this dopamine is that it helps to reduce that rigidity and tremors, and it increases the alertness of patient. So it increases the uh, alertness of patient. So normally the person that having this your Parkinson disease, so they are inactive. So, so while taking this, after taking this dopamine, this it increases the alertness of patient. So the person become alert. Then the side effect is it causes nausea, vomiting, and cardiac arrhythmia. So these are the side effects. It causes nausea, vomiting, and cardiac arrhythmia. So this about second anti-Parkinson drug. So that is dopaminergic agent. So dopamine is the important neurotransmitter in the central nervous system, and its depletion is associated with the clinical condition of Parkinson disease. Thus, compound which able to replenish the dopamine in the central nervous system and themselves act as a Parkinsonism drug are called as dopaminergic agent. And the example is this levodopa, it's alpha amino acid derivative. When this undergoes decarboxylation in a brain, you will get this dopamine. So when levodopa is administered, it can penetrate the blood-brain barrier (BBB) and get decarboxylated to give dopamine. Thus, it can replace dopamine in a brain. So thus, it can replace the dopamine brain which is depleted in the patient having Parkinson disease, and it also used to control similar neurological symptoms caused by manganese poisoning. And levodopa belongs to amino acid alpha amino acid class of compounds, and the use is it is commonly used as a anti-Parkinson drugs, and it helps to reduce rigidity and tremors and increases the alertness of the patient. And the side effects is it causes nausea, vomiting, and cardiac arrhythmia. So these are the side effects. And this is the bottle of your dopamine, which is called as brain food, mental right. Brain food, food for the brain, because in your brain that neurotransmitter is not working, that is dopamine. So this dopamine helps to replenish the dopamine in CNS, and it itself acts as a anti-Parkinsonism drug called as dopaminergic agent. This is all about. Then thank you.
Parkinson's is the second most common neurodegenerative disease after Alzheimer's. The most visible features of this disease are a slowness of movement, muscle rigidity, and tremors at rest. There are also many, often debilitating, non-motor symptoms, some of which may present before the motor problems. Parkinson's affects many areas of the nervous system and different types of neurons. However, much focus has been placed on neurons in brain regions associated with the overt motor symptoms, notably a region of the midbrain called the substantia nigra pars compacta. This region forms part of a major pathway in the brain that's critical for facilitating movement. In Parkinson's, dopaminergic neurons in the substantia nigra gradually die, leading to the malfunction of this pathway and the characteristic motor problems. Drugs that replace or mimic dopamine are often used to treat these motor deficits, but they grow less effective over time. Deep brain stimulation may also be used to treat symptoms. However, no current treatment slows the neurodegeneration. A distinctive pathology in most cases of Parkinson's is clumps of misfolded proteins within neurons. Lewy bodies are the most common type. A characteristic component of these is a misfolded protein called alpha-synuclein. These molecules can form small repeated units called oligomers, or longer fibrils. Mounting evidence indicates that these are toxic to neurons and play a key role in driving Parkinson's. Unwanted proteins are normally cleared by the cell's different types of protein-degrading machinery. Some evidence points to these systems being overwhelmed by misfolded alpha-synuclein, and this might be a key factor in what kills the neurons. Parkinson's has also been linked to problems with mitochondria. Mitochondria provide cells with the energy to perform vital functions. They're highly dynamic and can fuse together or break up into smaller versions in response to a cell's energy demands. They can also be transported to areas of a cell that need them the most. However, in Parkinson's, these processes can be impaired, and mitochondria are unable to sustain proper neuronal function. As they become old or damaged, mitochondria are removed and replaced. Again, this recycling is thought to be disrupted in Parkinson's, leading to the accumulation of damaged or worn-out mitochondria. Another idea is that the cells called glia surrounding neurons may play a role in Parkinson's. As dopamine neurons are lost, one particular type of glial cell, called microglia, is thought to take up the resulting cellular debris, triggering an immune response. Once activated, they release inflammatory cytokines, which activate neighboring microglia and another type of glial cell called astrocytes. Chemicals released by activated microglia and astrocytes have been shown to injure neurons. It remains unclear which mechanisms drive the disease process in Parkinson's. What is clear is that with time, more areas of the nervous system develop pathology. And one emerging idea is that this happens through the transmission of misfolded alpha-synuclein. While the multifactorial nature of Parkinson's disease progression might make it hard to fully understand, it does provide a number of potential therapeutic targets for slowing or even halting the neurodegeneration. For example, enhancing the clearance of abnormal proteins and blocking their transmission, improving the function of mitochondria, and targeting the neuroinflammation are all currently